Hi, I'm Kristen Bass, and I'll be the nurse practitioner student assessing you today. Do you mind starting by telling me your name and date of birth?
Cody Bass, June 23rd, 1997.
Perfect. I'm going to go ahead and go wash my hands and apply gloves. I'm going to start by taking a look at your vital signs. Your blood pressure was 120/80, your respiratory rate was 16, your pulse was 65, your temperature was 98.6 Fahrenheit, and your oxygen saturation was 100. So those are all within normal range. I'm also going to do your general inspection. So you appear physiologically stable. Your appearance is well groomed and your manner is appropriate. I also inspected your gait when you were walking in, and your gait was symmetrical and coordinated. Can you also tell me where you're at right now?
My house.
And can you tell me what today's date is?
November 22nd, 2025.
Perfect. So patient is also oriented times 3. So now I'm going to go ahead and inspect your head, scalp, and your fingernails, and just your skin. So first, taking a look at your head is nice and symmetrical, eyes are symmetrical, and then your smile is also symmetrical. So I'm going to start now by inspecting your scalp. Okay. And no abnormal lesions on the scalp. Hair distribution is also normal. There's no abnormal balding. All right, I'm going to start by taking a look at your nails. So nail bed color is normal. The fingernails are not cracked or brittle. I'm going to do cap refill. That's less than 3 seconds. And less than 3 seconds. So that all looks good. I'm now going to go ahead and move on to assessing your head, ears, eyes, nose, and mouth. Alrighty. So again, just inspecting the head. The head's nice and symmetrical. I'm going to take a look at the eyes. So again, eyes are symmetrical. I'm going to push down and just take a look at your sclera or your conjunctiva. So conjunctiva is nice and pink. Normal eyelash distribution. His sclera is white and shiny. Pupils are midline and they're about 3 millimeters. And then moving on to assess the ears. So just inspecting first, skin is all intact. There's no abnormal drainage from the ears. I'm now just going to palpate the ear, so you're just going to feel me pull up, back, and down. And tell me if you feel any pain. Any pain? Good. Pull back. Any pain?
No.
Point down. Any pain?
No.
Good. I'm going to palpate the tragus. Any pain at all?
No.
Alright. Now I'm just going to take a look inside the ear. So I'm going to pull up. Good. And tympanic membrane is gray and pearly, and there's no fluid behind the eardrum. Do the same thing on the other side. So just inspecting the ear. There's no abnormal drainage. Skin is all intact. I'm going to go ahead and palpate the ear. So let me know if you feel any pain. I'm going to pull up.
No.
Back.
No.
Down.
No.
Good. I'm going to palpate the tragus.
Nothing.
Any pain? Good. I'm just going to take a look inside the ear again. I'm going to pull up. Good. And tympanic membrane is gray and pearly. There's no fluid behind the ear. And now I'm just going to palpate your sinuses. All right, so tell me if you feel any pain. I'm going to palpate the frontal sinuses. Any pain?
No.
Palpate the ethmoid. Any pain?
No.
And the maxillary. Any pain at all?
No.
Good. And I'm going to go ahead and inspect the nose. So nasal septum is midline. I'm just going to push up slightly and take a look at the light. So looking inside, no nasal drainage, no polyps or abnormal masses within the nose. And I'm going to go ahead and take a look in your mouth. I'm going to start with the lips. Lips are nice and moist, no cracking. I'm going to have you open wide. Good. Oral mucosa is nice and moist and pink. All teeth are intact, no chipping, and no cavities noted. Gums, I'm gonna pull down, I'm gonna pull up. Gums are nice and pink. I'll have you stick your tongue out. Good. I'm gonna take a look at the upper palate. And palate's intact. I'm gonna have you stick your tongue out and say ah. Uvula is midline. Alright, I'll go ahead and stop. And tonsils are grade 1. So now I'm going to move on to inspecting your neck. So just taking a look at the neck, the trachea is nice and midline. I'm going to go ahead and come from behind. I'm going to palpate your thyroid. On inspection, there's no swelling or enlargement of the thyroid. You look up a little bit. Now swallow. Good. You can feel the thyroid move down, and there's no abnormal masses. All right, I'm also going to have you perform range of motion. So I'm going to have you tilt your head down to your chest. Good. I'm going to have you look up at the ceiling. Good. I'm going to have you look to your right, look to your left, bend your head to the right. Good. Bend your head to the left. Perfect. And then I'm also going to palpate the lymph nodes within the neck. So just palpating the anterior cervical lymph node, palpating anterior, posterior cervical lymph node. And there's no abnormal hard lymph nodes. I'm going to move on to the supraclavicular. Good. And again, not feeling any abnormal lymph nodes, no nodules noted. All right. Now I'm going to move on to assessing your lungs. So inspecting the chest, I don't see any labored breathing. Respiratory rate is 16. I'm just going to palpate your chest. So I'm just going to put my hands right here. Take a nice deep breath. Good. And there is symmetrical rise. All right, go ahead again. Good. Nice symmetrical rise. Again. Good, and there's nice symmetrical rise. I'm just going to have you scoot toward the edge of the chair as well, and I'm going to do the same thing on the back. Nice deep breath. Good, symmetrical rise. Nice deep breath. Good. Symmetrical rise. Nice deep breath. Good. And there is symmetrical rise. Any pain at all when I was palpating?
No.
Perfect. Now I'm just going to do what's called percussion. So I'm just going to tap on your chest. And usually I would do this without a shirt on. Starting above the clavicle. Okay. Okay, I'm just going to work my way down. Okay, now your normal renaissance. Same thing on the back. Very good. And again, normal renaissance on the back as well. And now I'm just going to go ahead and take a look into your lungs. So I'm going to start above the clavicles with the bell. Nice deep breath. Good. Nice deep breath. And anterior lung sounds are clear. I didn't hear any wheezing or crackles. I'm also going to use the bell. Nice deep breath. Perfect. And lung sounds are clear with the diaphragm of the stethoscope as well. Now moving on to the back. Good. And posterior lung sounds are clear as well. So now I'm going to move on to the cardiac aspect of the assessment. So I'm going to go ahead and start by palpating your carotid artery. I'm going to start by listening to your carotid artery. I'm listening for any bruise, which would sound like a swishing sound. So I'm going to take a deep breath in and out and hold it. Perfect. Take some deep breaths. And there was no swishing noted. I'm going to do the same thing on this side. And I'm listening with the bell at my stethoscope. Good. And no swishing noted. I'm now just going to palpate the carotid arteries. Good. Nice and strong, +2. I'm going to come and do the other side as well. Nice and strong, +2 for the carotid arteries. And I'm also just going to have you tilt your head to the side slightly. And the patient has no jugular vein distension. We'll look on the other side as well. No jugular vein distension noted. All right, and I'm now going to move on to listening to the heart. I'm going to start with the diaphragm of my stethoscope. I'm going to start by listening to the aortic valve. Good. Moving on to the pulmonary valve. We go to the mitral valve. And the tricuspid valve. Great. Now I'm going to listen in the same areas with the bell of my stethoscope. And I hear the normal S1, S2, no extra sounds noted. I'm now going to assess the extremities for edema. Take a look at your feet. No edema noted. And I'm going to assess the peripheral pulses. So temporal pulse is +2. Move on to the brachial pulses. Those are +2. Moving to the radial pulses. +2. We're going to say the femoral pulses are also +2. And I'm going to move down to the legs. Popliteal R+2. Posterior tibial R+2. And the pedal pulses are also +2. Good. So those are within normal limits. And now I'm going to move on to inspecting the abdomen. So just inspecting the abdomen first. Again, I would be doing this without a shirt on. The contour of his abdomen is nice and flat. I'm now going to listen to the bowel sounds. Get the camera up so you can see better. Good. And bowel sounds are all active in all 4 quadrants. So now I'm going to move on to listening to abdominal bruits. So I'm going to find your belly button and listen right up here. Take a deep breath in, out, and hold it. Good. Take some deep breaths. No swishing noted. And whenever you're ready, I'm going to do your renal arteries. Good. No swishing. Whenever you're ready, I'll do the other side. Good. No swishing. Take some deep breaths. And I'm also going to listen to the iliac. Deep breath in and out and hold it. Good. Good. And no swishing noted. Now I'm going to move on to percussion. Again, I would be doing this without a shirt on the patient, and I'd also have them lying down. But just to give a general idea of where I would do it and how I would do it. So I'm going to sit up nice and straight. Good. And it sounds drum-like, which is normal. Now I'm going to lightly percuss and feel for any masses. Good. Any pain at all? And I didn't feel any abnormal masses. And also referring back to when I did my inspection of the abdomen, I didn't see any pulsating areas or any bulging areas. And diaphragmatic excursion was 5 centimeters. Very good. Now we're going to move on to our neurological assessment. So starting with cranial nerve number 1, if I had a Snellen chart available, I would be using that. We're going to say his vision is 20/20. Also, if I had an ophthalmoscope, I would look at the optic fundi. But for cranial nerve 2, I'm going to shine this light into your eyes, and I'm just going to see how your pupils react. Good. Same on the other side. Perfect. And the eyes constricted bilaterally when I shine the light into them. And what I'm also going to do is test your peripheral vision. So I'm going to have you tell me how many fingers I'm holding up, looking straight ahead.
2.
Looking straight ahead.
3, 2, 1.
Very good. Now I'm going to have you cover your right eye. Cover it with your hand. Good. All right. How many fingers?
2,
How many fingers?
1,
How many fingers?
3,
How many fingers?
2,
Perfect. Now I'm going to have you cover your opposite eye. How many fingers?
1,
How many fingers? Looking
2,
straight ahead. Good. How many fingers?
3,
Good. How many fingers?
2,
Try one more time.
1.
Perfect. All right. So he was able to correctly identify the fingers that I held up. So cranial nerve 2 is intact. Moving on to assessing cranial nerves 3, 4, and 6. I'm going to have you look straight ahead again, and I'm just going to have you follow your eyes with my pen light. All right. Good. And patient was able to follow the pen light, and there were no abnormal movements of the eye. Now moving on to cranial nerve number 5. So using my reflex hammer, I have a dull end and then a sharper end. So I'm going to press either the dull end or the sharp area to 6 different areas on your face. I'm going to have you close your eyes, and I'm going to have you tell me if it's sharp or if it's dull. All right, go ahead and close your eyes. Sharp or dull?
Dull.
Here, I'll let you feel the sharp end first, and then feel the dull end.
Okay.
All right, ready? Close your eyes. Sharp or dull?
Dull.
Look at it one more time. That's the sharp end. This is the dull end. Okay, you ready? All right, tell me if it's sharp or dull.
Sharp.
Good.
Dull.
Good.
Dull.
Good.
Dull. Sharp.
Good.
Dull. Sharp.
Good.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Good. So the patient was able to correctly identify if it was sharp or dull. And what I'm going to do next for this assessment is I have a cotton swab in the same 6 spots. I'm going to have you close your eyes, and I'm going to have you tell me when you feel it.
Now.
Good.
Now. 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 Now.
All right, perfect. So that is it for cranial nerve number 5. Moving on to cranial nerve number 7, I'm going to have you make some different faces for me. So I'm going to have you raise your eyebrows up. Good. Squeeze your eyes closed. Good. Smile. Good. Frown. Good. Puff out your cheeks. Very good. So cranial nerve 7 is intact. Cranial nerve 8, I'm going to test your hearing. So again, I'm going to have you cover your right ear. I'm going to whisper 2 words into your other ear, and I want you to tell me what I whisper into your ear.
Apples, bananas.
Good job. Now for the other ear. Yeah.
Dog, cat.
Very good. So cranial nerve number 8 is intact, and then also testing your balance for cranial nerve number 8. I'm going to have you stand up, feet together, and I'm going to have you close your eyes for about 30 seconds. All right, very good. You can have a seat. Patient was able to maintain his balance. So cranial nerve number 8 is intact. Moving on to cranial nerve number 9 and number 10. I'm going to shine this pen light into your mouth again. I'm going to have you say, ah, stick your tongue out. Good. So palate rises, and then uvula stays midline. I'm also going to have you take a sip of water. Good. So patient is able to swallow without any difficulty. I'm also going to verbalize that the patient's gag reflex is intact, that he's able to taste both sweet and sour, and that his speech is in normal range. Now, testing cranial nerve number 11. I'm going to come behind you and I'm going to test your muscle strength. All right. I'm going to place my hands on your shoulders. I want you to push up against resistance. Very good. And I'm going to place my hand on your cheek and I want you to push against resistance. All right. Very good. Same for this side. Very good. So patient has normal strength. So cranial nerve number 11 is intact. Moving on to cranial nerve number 12. I'm going to have you stick out your tongue. Back in. Good. Curl your tongue up. Curl your tongue down. Move your tongues to the right. Move your tongue to the left. Right. Very good. Cranial nerves are intact. I'm now going to move on to testing the patient's reflexes. So starting with patellar, I'm going to move down the camera so you can see better. Good. +2. Good. +2. And trust the bicep reflex. I'm going to push over this tendon here. Good. +2. Good. You're good. +2. And now I'm going to test the trapezius. Totally relax that arm for me. Good. +2. Good. +2. So now moving on to our last section, the musculoskeletal section. I'm first going to assess your gait. So I'm going to have you stand up for a moment. Face the camera up. So if you want to start up here, I'm just going to have you turn and walk towards the chair. Good. Turn and walk back. Very good. So patient is able to, I'll just have you stand right there. Patient is able to maintain his balance. His gait is also very coordinated. What I'm going to do now is assess the TMJ. Sorry. So I'm going to have you clench your jaw. Good. And I can feel the masseter muscles nice and strong right there. I'm going to have you open your jaw. Good. Close. I'm going to have you move your jaw to the right. Good. And to the left. Good. I'm going to have you protrude your lower jaw. Good. And back. Good. So muscles are symmetrical. I didn't feel any abnormal clicking of the jaw. So now moving on, I'm going to assess the trapezius muscles. So those are nice and symmetrical. I'm also going to palpate the areas. Let me know if you feel any pain, okay? Any pain at all? Good. And then assessing the cervical spine. Spine appears midline, and he also has normal curvature of the spine. So now I'm just going to palpate. Let me know if you feel any pain at all. And earlier we did range of motion of the neck, and he was able to do all of those appropriately. So now I'm just going to inspect your thoracic and lower lumbar of the spine. Again, those appear nice and midline, normal curvature. And I'm just going to palpate downward. And I can feel each individual spinal process with a small gap in between, which is what we want. Any pain at all when I palpated? Good. So now I'm going to do range of motion on the spine. So I'm going to have the patient touch his toes. Good. You can come back up. I'm going to have you point your chest towards the ceiling. Very good. All right. I'm going to have you rotate to the right and rotate to the left. And I'm going to have you stretch towards the right. Good. And stretch towards the left. Very good. So the patient has normal range of motion. And then you can go ahead and sit back in the chair if you could. Now I'm just going to go ahead and inspect the shoulders for symmetry. The shoulders are nice and symmetric. I'm also going to palpate your AC. Any pain at all? Very good. And I don't feel any crackling, no swelling of the joints. So now I'm going to check your range of motion for your shoulders. So I'll probably have you stand for this one again. I'm going to have you bring your arms up, all the way up. Good. And then bring them all the way back. Very good. I'm going to have you lift your arms out to the side. Good. And bring them back together. Now I'm going to have, with your right arm, make a 90-degree angle at the elbow. Bring it out and bring it back in. Good. And I'll have you do the same for the other side. Good. So the patient has appropriate range of motion. I'm now going to move on to inspecting the elbow. I don't see any swelling of the joint. Take a look at this side. Again, no swelling or redness. Now I'm just going to palpate the elbow. Let me know if you feel any pain at all. Above and under the joint. Good. And I don't feel any abnormalities when palpating. I'm going to come and palpate this side as well. Good. And I don't feel any abnormalities when palpating. So now we're going to test your range of motion for your elbows. So I'm going to have you bring your arms in. Good. Bring them back down. And I'm going to have you flip your palms up and back down. All right, very good. Now I'm going to go ahead and inspect your wrist and your hands. So I don't see any abnormal swelling of the joints, any redness for the wrist, moving down towards the fingers. No swelling of the joints, redness, or any deformities. Do the same for this side. Again, the wrist, there's no swelling, no redness. Moving down to the fingers. No swelling of the joints, no redness, no deformities of the fingers. So now for the range of motion for the wrist, I'm going to have you tilt your hands up, back down, side, side. Good, I'll have you make a fist. And you're going to do, you can do this one at a time, but you'll go counterclockwise for the right, clockwise, good, counterclockwise for the left, and clockwise. Good. And then for range of motion for your fingers, I'm going to have you make a fist. I'm going to have you open your fingers nice and wide, spread them out, and bring them back together. Perfect. So normal range of motion for the fingers as well. Now we're going to move on to the hips. I'm just going to go ahead and inspect the hips. And now I'm just going to palpate the hips. So feeling the iliac crest, the hips are nice and symmetrical. Any pain at all when I'm palpating? Good. All right. So for your right leg, I'm going to have you bring it out. Good. I'll move this chair and I'll have you bring it back. Very good. Same for the other side. Good. Very good. Now I'm going to have you bring your right leg out and in. Very good. Very good. So I'll have you sit in this chair. And I'm going to have you lift your right knee up. Bring the knee outward and back in. There you go. Very good. Same for the other side. Very good. So normal range of motion for the knees. For the hips, I mean. And now moving on to the knees, I'm going to inspect the knees. No redness, swelling, or deformities. I'm going to go ahead and palpate both knees. Any pain at all? Any pain?
No.
Go behind. Any pain?
No.
Alright. Palpation's normal. Do this side. Good. Any pain at all?
No.
Good. Any pain?
No.
Any pain?
No.
Alright, normal palpation. Now we're going to do range of motion on the knees. So your right knee, I'm going to have you bring the leg out and back down. Good. Same for the other side. Good. Any pain at all?
No.
Alright, normal range of motion. So now we're moving on to the ankles and feet. So I'm just going to go ahead and inspect the ankles. So no swelling or redness or any deformities. Same for the joints of the foot and the toes. Now I'm just going to go ahead and palpate. Good. No crepitus noted. No deformities. I'm going to do the other ankle as well. Very good. Any pain at all?
No.
No deformities, no crackling. Any pain?
No.
No, no crepitus and no abnormalities of the joints. So now we're just going to do range of motion. So I'm going to have you point your feet upward and down. Very good. I'm going to have you curl your feet inward. Good. And out. Very good. Can you lift your toes up? Good. And can you lift them down? Great. Perfect. And that concludes our head to toe assessment.